I'm now going to go on to talking about modifying techniques for adolescents. One of the difficulties is because they're in a developmental change, you can't respond and deal with adolescents as if you're sitting with an adult in a chair who can just sit there and merrily talk about things in the way that you've been trained to deal with adult therapy. There are a number of things that need to be borne in mind when working with adolescents. And I think one of the most important things is that they need to be motivated to come to therapy. One of the biggest problems that I have is reluctant teens being dragged to see me because they need to be fixed. Their parents are exasperated, frustrated, feeling at an absolute lost end as to what to do with their teenagers. And now I have this grumpy, recalcitrant person in the room who doesn't want to be there, doesn't want to talk, doesn't feel like they're the ones who have the problem. So I think one of the first things that's important is to try and assess, are they motivated to come to therapy? And this can be a work in progress. As part of the assessment, which is 1 to 3 sessions, what I try and do is see, if I start off with a reluctant adolescent, if they can find enough value and good in being in the space to connect and to feel like this is something worthwhile for them. I have had very angry teens calm down to a point where they actually think, hang on, actually this might be nice and this might be something that's worthwhile and useful for me. So it doesn't have to be that after a first session with a disengaged, aggressive person that you write them off. You need to give them a chance to form a relationship, for them to establish a sense of rapport with you and to trust that actually you're there on their side. One of the things that's vital in terms of this is I generally have my initial contact after the telephone call with the parents. I will see the teen before I see the parent. So I won't have an intake session with the parents where they get their version of the story across first. And I explain this to the parents on the phone, that the adolescent needs to feel like they've had a chance to tell their story first. That I'm not sitting there with a whole lot of preconceived ideas about them being impossible, difficult. So I generally will see the adolescent first for at least 1 session, and I discuss with them the fact that I will be seeing their parents for an intake session, and I give them the choice and option of being part of that historical background talk. I say to them that there might be times where their parents might need some privacy to discuss difficult things, but the transparency is vital, and if they're worried about what's being said about them, they're more than welcome to be in the space for the intake and history, but discussing with them the value of what it's about. We need to know where you've come from, what's led up to this point in time, because they're on a developmental path. And that is the most vital point. They're not at the, this is the person you are dealing with final product. They're a work in progress. And where they've come from in terms of what sort of baby, child, young 10, 11-year-old they were, indicates who they are and helps you understand who they are right now. And so that's where I say to them that their history is important. Interestingly, when I offer most teens this option, they generally say, no, I'm not really interested in taking part, and they don't come to the history taking. So other than the history taking, what is important is the adolescent able to use their language to discuss and talk about their feelings, and can relatively honestly talk about their behavior and some of the problematic stuff. You need to watch it if you have a lying adolescent who comes in and you can't establish sufficient rapport with them for them to honestly report what is going on. As part of this process, it is important that you have enough contact with the parents that they can let you know if a big thing has gone down. And you can check back with them and say, you know, but skirting around the issue of confidentiality, I'm really concerned something came up Is this what happened? If you have somebody who is lying consistently in therapy, you don't have a safe, trusting relationship, and the therapeutic relationship is not going to form enough for you to be able to work with the person. They need to be able to tell you when they do stupid, daft things, or if they're having horrible, desperate feelings. There needs to be a sense of trust. And also, if you have a sense that they are lying, you need to be able to gently check it out with them. You need to confront them. But this is something that happens often when you've formed more of a relationship. So if you have a child who's a pathological liar, you need to assess with the parents and with the child if this is the best form of treatment, or if maybe another form of treatment in terms of family therapy, where the family can all give collective input, or parental counselling to support the child is more important and more valued. You can't be just sitting there being told constant stories and you doubting, is this person lying to me or is this the truth? The other thing that's really important is there must be motivation for change, and this is often where it's really, really hard. Often adolescents tend to think it's everybody else that's the problem. It's if only so-and-so would just. My parents are unreasonable. It's all the problem is out there. And that is very much part of your assessment, is having a look at, if you gently bring it back to them, how do they take it? If you say to them, and they tell you a story about a he said, she said, and my friend did this, and they were so mean and nasty, can you gently, after listening and empathizing with how hard that could be, stop and say to them, do you think there's any part that you might have played in what happened? Or if you had a chance to do that again, would you maybe do it differently? Another way of having a look at it is to help them stop and mentalize. Can they think, how would my actions, behaviors, words have made the other person feel? Now this is tricky because in terms of their developmental stage, them being able to properly take perspective, put themselves in somebody else's shoes, is something that's working and developing. And depending on each individual adolescent's cognitive and emotional development, they will be more or less ready, available to think about things from other people's perspective, to mentalize what is going on in somebody else's mind. But fundamentally, they need to be prepared to do things differently. And this is where, if you can tune into their struggles, their difficulties, and let them know that actually change can happen, but you need to be the change that you're looking for. You can't come to therapy and expect everybody else to magically behave differently. You need to think about, what am I doing that's making my life hard? Is there a way that I could communicate differently? Could I stop and think before I say certain things to my younger brother, who I know responds really badly in particular situations? So these are all situations where you need to test out the adolescent's capacity to stop, think. If you prime them, can they maybe do some of that homework for themselves when they're at home in difficult situations? You want to turn into that little voice in their heads that says, what would Vanessa say at this point in time? And interestingly, I do have some of my teens who I've been seeing for a while who say, I was going to do this, and then I thought Vanessa would say, is that a good idea? Stop and think before you do this. And that can be a way where they slowly start internalizing the breaks, doing things differently.